Hi, everyone. Welcome back to the podcast. Before we get into the episode, I want to share some exciting news. We have hit 10,000 downloads. Such a huge success in such a short period of time because of all of you. Thank you so much for all the support, the shares, the feedback you've been giving us. We are truly honored to be part of your day. To say thank you, we are going to bring you even more educational content. Beginning August 2nd, we'll be releasing a new episode every Wednesday. And these episodes are going to be shorter, but very content-rich episodes designed to bring you clinical-focused information. Our regular weeks will remain as longer episodes with our amazing expert guests and industry leaders. We hope you love the new content, and we look forward to hearing your feedback. We are always looking to improve your podcast experience, so be sure to let us know what you think. Thank you again for our 10,000. We love you all. Check in with you soon. Welcome back to the Making a Multi-Million-Dollar Med Spa podcast, where we have real conversations about what it takes to run a successful business. Thank you for joining us as we share our day-to-day successes and, even more importantly, failures and mistakes. Listen in as we host some of our peers, colleagues, and other experts in the field. We hope you enjoyed today's episode. All right, so welcome back to the Making of a Multi-Million-Dollar Med Spa podcast. This is Kathy Toronto, and I'm here with Dr. Lina Vargas. I'm so excited to have you on today. You're just such an inspiration. I was kind of stalking your Instagram this morning, and there are so many fun videos. I love the one with it's probably because I have a 7-year-old, but especially I had the Mario Kart where you guys are like racing in to get.
Oh my gosh, we had so much fun.
And it just looks like your team just really enjoys it as well. So it's fun to see all of that. But
yeah,
let's start out with a little bit about your background. You know, where did you grow up? What were your
parents?
Yeah. Do you have other doctors in your family?
Well, first of all, thank you so much for inviting me. I've been following you on Mint and this podcast. So for me, it's an absolute pleasure and honor to be here. So thank you for that. And then, I am from Colombia. I was born in Bogota, and I was born and raised. I did all of my schooling, did medical school back in Bogota. And then I moved to Cleveland, Ohio in 2005 to do a research fellowship in cardiac and vascular surgery, and then ended up doing vascular surgery. I stayed there for that. I finished in 2014. It's crazy that next year I can say that I've been a vascular surgeon for 10 years. Wow. It's absolutely insane. Wow. Yeah.
And you only look like you're 22. How'd you do all that?
I know, it's like hard for me to believe, but I essentially for the first years of my career, I practiced as a vascular surgeon, taking call, hospital-based, doing everything, vascular surgery, until 2018 when I saw the light. And things, I definitely believe that things happen for a reason. And at that point, so many things were kind of happening that just helped me and my husband kind of make the decision. That's something we had been thinking about, of just going on my own, opening my own private practice, just becoming my own boss, being able to control my life, being able to be there for our family. We have 2 daughters, and just have that kind of control, not depend on the hospital, not take call. And I opened this private practice. I'm the owner of Lumina Vein and Aesthetic Institute, and we're in Windermere, Florida, which we absolutely love. And I decided I gave up my arterial practice. I really devote my work to vein disease and, essentially vein work, which is what I really, really love and specialize in. And then very early on, we adopted, the aesthetic side of things, mainly at first from the vascular standpoint. And then, just broadening to everything else and this amazing world of aesthetics. And that was the beginning.
Wow. I mean, such a diverse background. I have to take a step back to, moving from Bogota to Cleveland, Ohio. And, what was the culture shock of that? Or maybe what did you miss? Or what did you,
Yeah, I mean, from it's definitely been crazy to go from, from Colombia to Ohio. I mean, I lived in Bogota, which is crazy, almost like think New York City, like, just a concrete jungle, very busy, crazy, just very little time, lots of traffic. So going to Cleveland was nice in that it was definitely like the pace was much slower, different kind of environment, but then definitely for sure, as far as the weather was like the biggest like change,
I
because
bet.
for those of you who don't know, there's literally no seasons in Colombia. So the weather is literally the same year round. And going to Cleveland, which is like winter, is insane.
I bet your
And
wardrobe changed.
yeah, it's absolutely crazy. So definitely that was one big thing. But then, as far as I think the cultures are very similar. And I was blessed to just really like find and make friends very easily, both at work. That's literally where I spent literally all of my time, was at work anyways. And but I've always been blessed to like literally just find people who become family, that they're supportive, that helps you like not missing home as much. And thankfully we do get to go back home very often, so that makes it easier. But yeah.
Well, so, what drew you to medicine?
It's hard for me to tell. I think I've wanted to be, I always wanted to be a physician. I always wanted to be a surgeon very early. Like, I guess the only thing that I ever contemplated was architecture. I love drawing. I'm very like, I'm a perfectionist. And so that's kind of like the only thing that I considered. And that was because the health system in Colombia, had a lot of issues even at that time. And, we're talking 15, 17 years ago. And so a lot of people, like including my mom, they were like, I mean, it's crazy for you to go through such hard training to then face like these situations with like the broken healthcare system. Like, is it even worth it? But I'm telling you, I wanted it. It's what I wanted the most. And so, I just went through it, and I don't regret it a single day. Now, what I did know, like going through medical school, is that I wanted to come to the United States to do my my training following medical school. So, I was the crazy one with like all the medical books in English.
I know. I was
Yeah,
thinking
so like
that
all
as
the
well.
pathology and histology and anatomy, and like all of my books were in English, even though we were in Colombia. So I was kind of like just very focused on, I wanted to come here to do my residency and do research and all of that. And so I did. I definitely wanted that from like the very beginning. And then surgery wise, that was also like very easy to me. Like, I just wasn't as excited when I was in the rotations, where it was like internal medicine, when we're just rounding on patients. And, I loved being, just having to get to the hospital super early. We barely saw the sun, but like just everything was fast paced and just moving and go, go, go. And one day is never the same as the next. You never know what happened, what's going to happen. And the cases, if they go quick, if they go slow, if you need to add, an urgent case. So I absolutely love that pace. And so that going into surgery was also like very, very easy for me to decide.
Well, I think that's amazing that you had that vision so young. I mean, I almost feel like you kind of need it to get through
Mhm.
everything that you did, especially if your mom, who I'm sure you love and trust more than anyone in
Yeah.
the world, is saying, like, are you sure?
Are you
Are you
sure?
sure?
I know. I know. That's
Uh,
how moms are. I mean, I remember when I told her, like, I'm quitting my job as a vascular surgeon, and I'm going to open a private practice, and she was like, oh, wait, what? Like, are you sure? Like, are you crazy? Like, and I was like, absolutely, I'm sure. And then even today, to this day, she's like, see, now you work more, than, you used to work. But I'm like, of course. I mean, when you're a business owner, you work more than, ever, than if you're like, just a regular 9 to 5 or employed or whatever. But it is your baby, right? It's like,
right.
it's your project, it's your dream. And so absolutely, you're going to work as many hours as you need to. I mean, it's 24/7, because you want your baby, you want the business to do well. And so, so I'm like, absolutely, mom. But I'm like, I absolutely enjoy this. And I'm just so grateful to have taken that step, and where I am right now, I'm just, I wouldn't change it for anything in the world.
So coming from the hospital and stepping away, and you're also a mom, you had mentioned, kind of making some decisions because as a mom, you wanted to have a different type of schedule. Stepping away from that and starting your own business, what have been the biggest surprises? Maybe something that's, you didn't realize you would encounter so often, or something that's been more difficult, a learning moment, or something that's just been way better than you thought.
Yeah, I think, essentially, and especially coming from medicine, I don't know from like other, careers, we get very, very little in terms of training as far as like how to even run a business or like what it takes to run a business. And so like literally everything about the, going solo and opening a private practice, everything has been, there's definitely a learning curve, and some things have been easier, some others have been a little bit more challenging. But I think at the end of the day, it's all very obviously rewarding. I think that you never really know. I mean, you kind of like have an idea of like all the things that you're going to have to do, but then it's almost like you have to dive into and like start facing all the fires that come up, like even with like little processes and things that you would never imagine. But I think that, like, it's been amazing to just, I'm very, very lucky to, have found a team like very early on. You need that team to kind of like help you, because there's no way you can do everything, right? And so like I've been blessed to have, my manager, she has been like instrumental in making this a success. So like she's like incredibly smart and absolutely loyal, and she's Lumina, like, like family for life. And so like, she's been able to deal with some of more of like the admin things. Then, from the medical side of things, same. I mean, before you just kind of like, when you're employed, you just show up, you have your schedule, you have your patients, you do your surgery, and then, you take the phone calls, you do your charting, but that's it. But, looking at things from the business standpoint, just, you have to take so many other things into consideration as far as like, even what kind of treatments you offer, what kind of devices you bring on, and look at it from different angles as far as like the cost, what's going to be effective. There's so many other things that come with that you would have never like even thought about when, prior to owning a business. I would definitely say that, it's very rewarding when you find the right people, but it's also so challenging when, someone just does. And I know you guys are so good about like the interview process. Like I've learned so much from you, because at first you're like, and especially when you're small and, when it's harder to like, like really like be able to attract the right people. And so like going through that struggle of really figuring out who's a good fit and learning, and we've learned that you have to, like follow your gut. And even though you may like someone, if they're not the right fit for your business or they don't have the right personality, like you just have to like, move on and just find the right people. So identifying who those people are has definitely like been one of the biggest challenges.
So
For sure.
where did you find your manager? Because this is a question. I mean, I get asked a lot, and our manager and assistant manager from aesthetic care both came from Dillard's. And
Okay.
so, I think a lot of people look at like, we've got to hire someone that has industry experience. And really, when you look at what their main role is in the business, it's managing people. It's a retail type of business, and they have been hugely successful, and we're so grateful for them. But I'm just curious, where did you find your superstar?
Yeah, I literally, I win like the biggest lottery in the world with her, because so she actually was the manager at the practice at my last job in the hospital. So she was the manager at that practice. She, and then my first ultrasound tech, we were part of a team, when I was still employed by the hospital. So then, we worked amazing together. We had the same personality, like we had the same values. We treated patients the same way. And so when, it's funny because when I decided that I was, leaving and, opening the practice, and, obviously that was kind of like a long process, almost like a year from the moment I handed in my resignation because I wasn't sure if they were going to enforce the non-compete, which sometimes for physicians, you cannot work in a 25 or 50-mile radius from where you worked before. So I wasn't even sure that I was going to be able to open the practice, where I opened it. But for that year, they were like, we're coming with you. We're sticking together. Like,
I love it.
I know, it's so insane. I still like it almost
that,
like
that
gives
says
me
so
shivers
much.
when I tell that story. It's because it's incredible. So this my manager, she actually decided to, because also on my contract I couldn't hire anyone from the office.
Wow.
And so she actually left the office to work somewhere else while I got everything set up. And then I was able to hire her from that.
Wow.
That just speaks volumes as far as like how, that commitment and that loyalty, and just, it is, I'm telling you, I'm absolutely blessed. It's insane. I just got lucky.
Like, that gives me goosebumps.
Yeah.
That's a lot of faith.
Hey listeners, it's Karen, the marketing director of Aesthetic Care Med Spa here, and I wanted to share an incredible resource that has changed the marketing game for our virtual events here at Aesthetic Care. Our events partner will provide all of the items that you need to put on a professional, organized virtual event with ease. You provide the assets, pictures of your staff, or whatever treatment that you're trying to promote only takes 90 minutes or so, and they do everything else. Following the event, they'll even provide you with detailed data analytics so you can see exactly how many people attended, who stayed for the entire event, track who's interested in getting your treatment or special that you're promoting. You will even have automated follow-up texts. I'm telling you, it will make your virtual events easy, breezy, and they do all of the marketing. It's incredible. For more information or to see a case study or two from Aesthetic Care Med Spa, check out the link in the notes below.
It's a lot of faith.
Which says a lot about you and the relationship that you all had.
Yeah, I think it speaks volumes about that, and thankfully, like, it's been, for us to grow together. Obviously, it's, and we're so close, like our families, like, we've walked this path, and I know that, I tell her, I'm like, she keeps saying everyone is replaceable in this world, but I'm like, I'm telling you, the day that you tell me I'm closing Lumina, because I cannot even imagine any of this without her. And so, but yeah, it's then, we've been lucky again just to find really good people, and sure enough, we've had, to let go some people have had to leave for other reasons, but today, I can tell you today, the team that we have is absolutely amazing. We are, we're here to work. We're here for the patients. We're here to deliver great care and excellent customer service. Like you're saying, it just goes back to that. It's that, like you're saying, that Nordstrom experience they have, it makes perfect sense for them to come from that background, because at the end of the day, especially, medical can be a little different. Patients need that. But when we're talking about aesthetics, patients want that, right? And they can find that, and they'll look for that Nordstrom experience, that amazing, just even when they walk through the door before they've had any interaction, just that place that feels amazing. And then with the interactions, they just feel like they belong there. And so, it just makes sense that some of the staff may come from that background, because it's the perfect setup for that.
Well, I love your story. I think so, I've had an amazing opportunity to work with so many clinics around the United States. And oftentimes I'll work with physicians that are either ER doctors, or whether it's a vascular doctor or an OBGYN or a family practice, and they've opened up an aesthetic center, and they're still working part-time in the hospital and then trying to get their aesthetic clinic up and going. And, my philosophy has been always like, you just got to jump in, to split your time that way, to me seems so, it's to your, like what you were saying earlier, there's so many surprises that came with opening a practice. How do you think it would have gone if you would have stayed half in the hospital and half trying to open your aesthetic clinic?
Yeah.
What do you think, or what would you say to them?
I think it would have been, I mean, it's always been a challenge and it never stops being a challenge. I mean, as you grow, I know that you guys have recently expanded, and I mean, all of that, even that growth with a practice that's super established. I mean, everything just demands you like 120% or 200% of you. So I don't see how, if I had done this, half and half, I mean, I guess I could have made it work, but it would have been, a way harder. And I don't think that we would have done it like halfway as good as we've done, right? Because you just have to be here. I mean, I can tell you from, when I opened the practice, I still thought that I could do a little bit of arterial work. And very, very quickly, I, figured out there's no way, like, this clinic is, and this office, and this is not going to work if I'm not 100% here and 100% committed to, the patients and being available and being here to like deal with the situations that arise and all of that. So, I mean, to say that it's impossible, I don't think it's impossible, but I think it's just going to be much harder, take way longer, and the results are just not what they're gonna be. I mean, I think that when anyone who's thinking about an aesthetic practice, like, again, it all ties back to that client experience, that customer service. And if you're gonna do things like halfway done, it's probably better to not do them. Just, that's just my opinion. I think that there's no way we could have gotten where we are if we had like done just half the effort, which is what you can do if you're 50% of you is somewhere else and has other responsibilities and commitment. So
right. Well, I agree. I was just curious because you had gone exactly through that,
Yeah.
So I think it's so helpful for our listeners to hear about your experience and how you got the courage to just, to go for it 100%, 120%.
And I'm telling you, I do have to say, I mean, it would be unfair to not, like disclose that I am also in a fortunate position in that my husband, like my household does not depend fully on me, right?
Mm-hmm.
And so, because the story may be different for someone who, their families depend on 100% of what they do. So, I think it's only fair to like say that, I'm fortunate in that I had full support of my husband, and my household was not going to like fall apart because I, just suddenly decided to do this. So that definitely, that situation may be a little bit different and just make it a little bit more challenging for someone. But yeah, I mean, I think that if you can, like, the goal should be to just go 100% into the plan and make it work when it's like the right time, right? And that maybe you wait a little bit longer and kind of like get a stronger foundation, and then when you're kind of like just planning so that when the right time arrives, then you go 100% in.
Definitely.
Right? Mm-hmm.
Definitely.
Yeah.
So looking at your practice, what are the top 2 or 3 procedures that you are the most passionate about, or that you do the most?
Yeah. So I, as a vascular surgeon, I absolutely love my veins. So I love sclero, and I love, just treating varicose veins and just helping people kind of get their legs back. And being in Florida, like literally everyone, I mean, it's, and I'm telling you, my mom is still to this day like that. I mean, she's like, she won't go to the beach and wear a swimsuit like comfortably because she has spider veins and all of that. And so, as much as I tell her, this is your life and who cares? Like, nobody's looking, just go and, wear your swimsuit, and it doesn't matter your legs. People do worry about that. We're our own worst critics. And so being able to help women and men that way, that is very, very satisfying. And then from the aesthetic side of things, I mean, I really enjoy I love Halo. I'm like a huge Halo fan. Oh my gosh, I absolutely love Halo, and just the results that we see, just the changes that we see are just so incredible that Halo has got to be one of my absolute favorite treatments to do. We essentially offer pretty much every single BTL device treatment here in the office, but so it's very satisfying to see the results, but I don't get to do those. Obviously, those are, I hear them going, but I don't do them because I don't have to. But it's also very satisfying to see the results that we are getting with, with things like M-Sculpt and M-Face and, M-Cella, it can be life-changing. So those are definitely like very gratifying treatments to offer in our practice.
So being such a specialist in sclerotherapy, how often are you using Sclero versus something like, an Nd:YAG, maybe
Yeah.
Clear
Mm-hmm.
V or
Right. So I definitely I'm very, very, I guess it depends because if it's the legs, I definitely, Sclero is the absolute gold standard, like no questions about that. So we're very, for leg veins, we're definitely, doing definitely like over 90% with sclerotherapy. Now, we do a lot of treatments for vascular lesions elsewhere in the body, and actually for the legs as well, for certain patients that just, for whatever reason, they don't want or cannot have sclero. But as far as the laser goes, we obviously we have Clear V, which is an Nd:YAG, and it works beautiful for face veins. We've had amazing results for under eye veins, or like, the little broken capillaries on the face or the nose. I mean, it's just, we use them both and we use them all the time. It's just, I think, vein legs or leg veins are definitely like, they resolve much better with sclerotherapy. There's just very subtle differences between the veins in the legs as far as them being under more pressure. It's more deoxygenated blood versus more of the oxygenated blood that we see, for example, in like broken capillaries on the face. So, I mean, it's just nice that we have both tools. And it's mostly like the location and the type of the vascular abnormality that we're treating. But, we see great results with both. We love both.
Well, I was asking too, I know we've talked in the past about sclerotherapy and just, really the training that it requires to really be good at it. And I think similar to how we were talking about in business, kind of having one foot in and one foot out, it makes it difficult. You just really can't dabble in sclerotherapy either,
For sure. Yeah.
Right. I mean, it's like, if you're going to do it, get the right training, spend the time to get the right training, spend the money to get the right training, practice a million times, and then launch it and be ready to have either yourself or someone else doing it often so that you don't lose that skill is what is what we feel, because we have a specialist for sclerotherapy in our clinic. And so I'm just curious, if you were to train, because I know you also do training, so I'd love to hear about that. When you do offer training, what are your suggestions? How does that training look so that you can help a provider get up and going with sclerotherapy? Because I know so many clinics want to offer it. They're just not sure how to get started or where to go.
Right. I think that, obviously we start with like a, basic foundation and understanding of, what those are things to look for, because I think one of the main reasons why even people who are doing it routinely, like fail is when they don't identify that there's a deeper issue that needs to be addressed. I mean, even before you start injecting anyone, I think like there are basic questions and just a basic physical examination that will give you hints as to whether someone may have a deeper issue that needs to be addressed first. And the easiest way that I put this, to the patients or I explain it is, if you have, a stain on the wall, you can go to Lowe's or Home Depot and buy paint every weekend. You're going to be painting over that your entire life until you get that pipe that's leaking behind the wall fixed. It's literally the same thing. So if you have an issue as far as like venous insufficiency, or you have higher venous pressure from, venous insufficiency or venous congestion, you can do a sclerotherapy all day and be great at it. You're never going to get the results, and you're just going to be spending time and money and not get the results that you want. So kind of like understanding that foundation is very, very important, because it can be very frustrating. And then as far as the technique itself, I mean, it's actually not very hard, but it's just, kind of like sharing those tips and tricks. And like you were saying, Kathy, I mean, it's all about just doing it. And so, it's kind of like getting over that hump of like being afraid and being scared of this being like a, brand new procedure that you're bringing to the office. It's actually very safe. It's very, very hard to like hurt someone with sclerotherapy. It's more getting good at it so that your patients are happy with your results and you don't have like, unsatisfied patients that are coming back because they're not getting the results, right? So just sharing those tips and tricks. And at the end of the day, it's just, obviously they'll get to do some injections while they're here. And, the most important thing, and I think that applies with like everything when you're learning Botox, when you're learning fillers, when it's trying to get busy and doing it like, frequently, like as soon as you're done with your training, like don't let a lot of time go before you start really like doing it. And whether that means, I'm telling you, you'll find people who have spider veins literally like everywhere. You don't have to find for them. They're everywhere. So just ask. And I know, a lot of people will want to volunteer or, just do it at a lower cost at the beginning. But the main thing is to get as many like Sclero sessions under your belt as quickly as you can, because it's at the end of the day, it's all about getting comfortable. Mm-hmm. So that's kind of what we do. Like you're saying, there's literally very little in terms of training out there in the world. But there's, it's just gotta find like a good place that has the volume, that has the, the ability to like offer that to you. And then when you're back home, just get at it, because it's all about just repetition and doing it and getting comfortable. And like I said, just getting over that fear. Again, it's very, very hard to hurt someone. Obviously you can, but it's very hard to hurt someone. So, kind of like understanding those things is what we find is very helpful for the people and the clinics that come to train with us.
And so for training, if there are some listeners out there that are interested in that, could they just contact your office manager?
Absolutely. Yeah, absolutely. Yeah, they can contact our office. We can share like my manager's information. She can provide kind of like what we have set up. It's really fun and it's very, very easy. So yeah, we'd love to have, anyone out there who's interested in doing sclerotherapy and doing it the right way. Like we would love to share that.
Well, we will definitely link that in the bio for the podcast, because if you're going to choose, your office is just so successful with it. Your background is amazing. And look at her Instagram page. It's so fun. You're going to have fun when you go to her office. And I think that's a big part of it as well. Yeah. So we'll make sure to include that information when we get the podcast launched. So thank you for that. Thank you for being such an amazing resource.
Oh my gosh, no.
I was looking at, just kind of saying, so you mentioned Sclero and Halo, and you're a BTL, focused clinic. Mm-hmm. So within all the BTL products, what do you find to be the most successful, or, what do you love about it? What makes you excited about BTL?
So what gets me really excited about BTL is the fact that they are very, very safe devices that truly deliver results. I also like, from my background in research, that they're backed by science. Like if you look at pretty much any of the devices out there that we use in aesthetics, like sure, there's some clinical papers here and there, and they have to come up with those papers to come, for the devices to be approved. But I think that it's amazing how the research is ongoing, and there's so much coming from like so many big names, both in the US and around the country, just showing that this, they really, really work. And again, in a completely non-invasive, very comfortable way. All of those treatments are extremely comfortable. And from a business perspective, one of the things that I love is that they don't require me to do them, right? Which is very important. So, while, Halo, I have to do the Halo. Sclero, I do the sclerotherapy, the vein treatments, I have to do them. So the minute that I'm not here, or if I'm giving a talk somewhere, or if I'm on vacation, BTL devices are running, right? So from a business perspective, it's really nice, because I know that, again, going back to the safety standpoint, I think it's really, for me, like I feel confident getting on a plane and leaving Orlando and knowing that the patients are getting treatment and that they're not going to get hurt, right? Like you don't need to be an MD to put someone on EMSCOT, right? And so
thank you for listening to the Making a Multi-Million-Dollar Med Spa podcast. We are honored to have the opportunity to support your practice. If you like this podcast, we would love it if you left a review. Ratings and reviews allow more practices and industry professionals to find us. If this episode has inspired you, share it with a friend. Together, we can empower our community through continuous learning. We truly value your support of the podcast.
it's just, I think, all of those things, the comfort level, the practicality of the treatments, how safe they are, and the fact that they don't demand my presence to be able to be running is, I think, is those are like the main factors that we really, really like about BTL devices.
So we have the Neo, and we had, we started with BTL with Exelis. I mean, we've gone through their products as well. We've had them, really since probably when Exelis launched.
Exelis was launched.
Yeah. But we don't have the M face, and I know you do. So I gotta ask, is it working as you would expect it to work? I mean, what do the maintenance treatments look like?
Yeah.
I'd love some details about the face, just for my own personal.
Yeah. So we love M-Face, and we have some, I mean, obviously there's BNA circulating everywhere from, some of the big names that have done all the research with them, but we have built our own library of BNAs with M-Face, which is absolutely amazing. We do use a Quantificare for our photography, especially for the body contouring, but has been really, really good for M-Face to see the lift. So when we do those BNAs and do the 3D analysis, we can really see the vectors as far as where the structures are being lifted, and we can actually quantify how much. And we
I'm not familiar with that. Sorry, I didn't mean to interrupt you.
Yeah.
I'm not familiar with that photography system.
Yeah, so we actually got it up first mainly for M-Sculpt, because it's just one of those that gives you like a 3D recon of the body. So you can only, not only see kind of just from looking at it, you get very, very detailed objective measurements as far as circumference, right? Abdominal circumference, and you can see volumetric changes. So you may have seen, there's some, for example, when you look at elastin, the transform body, how sometimes they'll do a BNA where there's a blue shade over the abdomen, which just shows volumetric change.
Mm-hmm.
So that's the kind of stuff that we can see with Quantificare.
And so because we had one for a little while that would spin.
Do you have the Staiku or?
Yep, the Staiku.
Yep. Mm-hmm. So it's similar to that. The patient just literally stands on this. It's a very small platform. I mean, barely just to fit your 2 feet kind of thing. And there's a camera, which the what makes it different is they patented this thing that goes over like a professional, like a Canon camera or a Nikon camera. And it is able to get kind of literally the same picture, same distance and everything with the rotation, and give you very, very precise measurements as far as the circumference or the volumetric change. And I'm more than happy to share that with you. But for M-Face, it allows us to see, again, that volumetric change, because we, in general, we tend to, studies have shown that when you do M-Face, you essentially gain almost like a full syringe of filler, right?
Mm-hmm.
And so we would expect a positive volumetric change in the face, aside from the lift. So we are able to see, arrows or vectors that show us the direction in which the structures have changed, how much lift, for example, we're achieving in an area, and then those volumetric changes. Obviously, it allows us to see the change in improvement in wrinkles and things like that. And so, we have a bunch of pictures, BNAs from our own patients that are just beautiful results. So our results have been really, really pretty. And, like I was telling you when we were talking the other day, I've had the pleasure of being able to help BTL launch M-Face in South America. And literally all of the pictures that I show are literally our own. Which is just very gratifying, right? Because sometimes, and this happens all the time. We borrow and we use pictures from other practices or other studies, but M-Face is one of those things that we've been able, and same with M-Sculpt, we've been able to use our own BNAs, which is just absolutely beautiful. Absolutely beautiful.
I always joke with Matt. I'm the photos sometimes take me longer than the treatment.
Yeah.
And when I know it's so important, but I think
it's
that's
so important. I know.
Yes. One of the reasons why clinics sometimes don't share is because they didn't capture it.
Yeah.
because the time it takes to capture and the busier you get, sometimes that starts to fall away.
It's crazy. And it's like kind of like the thing that you start, sacrificing when you're, when there's a time crunch and you're rushing and everything, or, the other struggle that we have. And actually just earlier this morning, I was having a conversation with one of my estheticians. She actually just literally took our computer, for the pictures, and she took it home and worked on it last night because we were so behind.
Wow, that's amazing.
But you have to, it's just such a key, just even to show, for your own patients. A lot of patients will ask for your own BNAs. Like they find the other stuff online. They want to see yours, or, for us to, again, like I'm doing, I'm talking about M-Face in other places, BTL, same thing. Like you want to be able to show your own experience, but even just for the patient, it's incredible how sometimes, patients will say that they see a change, but if you're able to show them something like an objective measurement, right? Like that
Right.
just is so powerful that they're like, oh my gosh, I felt this work, but this is like, oh my gosh, like I'm blown away. Or the opposite, they tell you, listen, I didn't see a change, but you show them, then you're like, I have objective, measurements and I have pictures to show you that